Um, Hi there, everybody. We have started recording. So my name is Chris French, and I'm Director of Strategy at Health Foundry, and I am hosting on behalf of Digital Health and the Pitchfest Rewired event. It's really great to have you all here. Just a little bit about Health Foundry. So we are a health tech incubator based in South London, and we are a space where people come together, partnerships are made, and that's certainly what we'll be discussing today. So what this webinar is about is establishing effective partnerships for digital health startups. It's something I witness every day in the space that I am in, physically, literally. And it's really important for digital health startups to get those partnerships established. But what do they mean? What's the best way around? Who do you connect with? And that's what we are going to discuss with our panel today. And I'm very pleased to be able to start introductions to them. So I'm just going to go along the row of my screen, everyone. So I'll call you out in sort of the order that I have here. So Sarah, Bruce, would you like to begin? Thank you.
Hi there. Yes, great to be here, and thanks for inviting me on. So I'm the co-founder and director of Silverbuck. We are the UK's specialist digital health and health tech communications agency. So we support a lot of startups, scale-ups, and big corporates in the health tech space to get their message out to the market.
Excellent. Thank you, Sarah. John.
Thank you, Christopher. Yeah, wonderful to be here. So I'm John, managing partner at Rise Asset Management, healthcare-focused investor, physician scientist by background. In terms of partnerships, Rise started as investor partners Digital Health London, and more recently we've worked with Novartis, Medtronic, and Chelsea Westminster Hospital with a kind of a themed focused on cardiovascular medicine. So yeah, that's a little bit about me, and looking forward to the discussion.
Thank you so much, John. Sean.
Yeah, echo, brilliant to be here. Great to see so many people from all over the place. So I'm Sean Butner. I work with the innovation team here at Chelsea Westminster Hospital in London. It's probably worth noting that the innovation program here is a partnership between CW Plus, who's the hospital charity, and the trust itself. One of my colleagues sits on the judging panel for Pitchfest. And it's also worth noting that one of the prizes for winning is the opportunity to work with us here at the team. And ultimately, our job here as a team is to deliver on innovation programs across the trust. Yeah, looking forward to hearing everybody's input today.
Excellent. Thank you, Sean. I think it's worth noting that's first prize as well in the Pitchfest. So yeah, really fantastic. Rachel.
Sorry, just unmuting. Yeah, delighted to be here. Thank you so much for inviting me. I'm Rachel Grimaldi. I'm co-founder and CEO of Cardmedic, and I'm a senior anaesthetic registrar in my final year of training at Great Ormond Street Hospital in London. So we're actually really lucky to also be working with Silverbuck that Sarah mentioned earlier. So we're one of their companies, and was also winner of Pitchfest last year. So delighted to join the panel today.
Excellent, and congratulations again. And Sarah, so I did leave you last because there was a fire alarm going off just as we started, and you're still there, so it looks like all is safe and good. Brilliant. Hi.
All is good at the moment. Thank you very much, and I'm so glad you came to me last. So very good afternoon to everybody. I'm Sarah Nelson, and I work at the Health Innovation Network South London. I'm the programme director there with responsibility for programmes including the Digital Health London Accelerator and other programmes to support the NHS and our companies. I'm also a previous judge for Pitchfest and a partner with Digital Health for Rewired. Digital Health is a partner for Rewired. So yes, very glad to be here today and looking forward to speaking with all the panel. Thank you. Excellent.
Thank you all very much. Just to give a little bit of a brief intro to Rewired Pitchfest. Some of you, I hope most of you will know about it, but so a startup competition offering innovators the opportunity to showcase their idea or solution to quite a unique audience of NHS leaders and investors at the Rewired main event in 2024. And as we mentioned, partnerships in building up those ideas, massively important, but what do we mean by partnerships? Actually, that can mean different things to different people. Partnerships for conversation, for ideation, for growth. So I'd like to start panel by asking you, please, to give your definition of partnerships, what a good partnership is, and how that can help. Partnerships go other ways as well, so how we can overcome those kind of challenges also. I wonder if we start with John, your ideas on what partnership is.
Yeah, no, thank you, Christopher. So obviously, we have to be realistic, because a partnership is a relationship. Relationships, they start and they grow and scale. But from an investor perspective, we're focused on contracting. So what does that look like in terms of revenue growth? For the company, it might start off with a bit of co-development. It might be a little bit less on kind of the financial transaction that's moving from the partner to company. It might be kind of gifts, it might be expertise. But I think what we're really looking for is the depth of that. So how serious is this partnership? How much is this going beyond a pilot? What markets is it providing access to? What additional channels is it providing access to? So we think about, obviously a healthcare provider, an insurer, pharmaceutical, medical device companies, and having a strategy which spreads a few channels is often ones that where we've seen success. But it's really the depth within one, rather than sort of having exploring all channels all at the same time. The limited amount of capital can be really challenging. So it's the depth and the revenue growth, which is what we're looking for.
Excellent. So depth over number of partnerships that you have, for example, what's actually relevant within those ones. Thank you, John. Sarah Nelson, your thoughts on partnerships? Oh, you're on mute, Sarah. There we go.
We have a couple of sort of ways that we partner with companies, and so for us that's the opportunity to support great companies who've been through a really robust process to actually work out who are those ones that will support NHS priorities at the time. So benefiting the NHS, a partnership that will do that, a partnership that will support the economic growth is really important to us within the Health Innovation Networks. So there's those partnerships, but then there's also partnerships through things like Rewired and our relationship with Health Foundry, where we can share best practice and we can encourage what's happening within London and our local area, and we can increase that networking. So there's an element of leadership in our partnerships as well. But there's lots of things that I'm sure we'll go into more detail about, sort of how we can assess that, what does it make a good partnership, but I'll leave it at just that for the moment.
Thank you very much. Sean?
I think it's such a broad question, so I'm going to answer it as narrowly as I can in two ways. There's obviously strategic partnerships and there's probably commercial partnerships. And when I look at it from my role, my partners who I serve are generally the hospital staff, and a separate part of my role is any outward facing into industry. So putting the two of them together, the key part of that from my perspective is clarity. And there's clarity on two things. The first piece is there clarity on the problem you're solving? Is it a problem, first off? Is it a significant enough problem that needs disruption and changing? And then the second part is clarity on what good looks like in it. So what are you trying to achieve? Is that clinical excellence? Is it operational excellence? Is it lots of different things? And that clarity piece, if it's not done right, I've seen it in the past where that's where stuff falls down, and ultimately the partnership becomes a little not volatile is the wrong word, but upset. So having that clarity on those is really, really key from my perspective.
Excellent. That part you didn't quite want to say volatility, but sometimes partnerships, that's something we will pick up on. And just that clarity point linking into Sarah Nelson's point about best practice as well, and helping to share that around, I think is important. I think I'm to Sarah Bruce next.
Yeah, so I think, relationships and partnerships are often used quite sort of interchangeably. And as Sean alluded to, and it's quite a broad question, but I think from my point of view, it's a partnership is more than about a kind of transactional relationship. It's about adding value consistently, and not just value to the person that's asking for the partnership, but adding value on both sides. Because ultimately a partnership only works if there's a win-win on each side of the equation. So I think for me, a partnership is really about a really trusted relationship that goes beyond transactional kind of means.
Excellent, thank you. I think that transactional piece is really important, in terms of what that relationship partnership will eventually become. And I wonder, Rachel, from your point of view, as a past winner of Rewired Pitchfest, then your partnerships and your journey through those.
Yeah, I mean, at the risk of not repeating what everyone else has said, because I think it sums it up really well. But just as John and Sarah Bruce were saying, that that term relationship really stands out, and that I think another way of kind of summarizing what Sarah was saying is about journeying together. So not just transactional, but you actually go through this journey together. And for me, trying to think about partnerships in the context of CardMedic, I think it sort of locally starts with our team. So partnerships within members of our team internally, and then our clients, which are the trusts that we work with. So we're Chelsea and Westminster being one of them, and we're across 5 ICSs in the UK and 1 hospital in the US. So each of those, whether it's even an air ambulance or a primary care practice versus a big integrated care system or a single trust, each require different things from us and vice versa. So I think it's partly that kind of relationship and partnership, and how can we support them, meet their needs to support their patients, and vice versa. Like Sarah was saying, it's you need a win-win on both sides in that perspective. Then we've been on several accelerators, and I see that as a partnership, because you're applying to be on those programs and taking a lot of knowledge from there and the network from there, but also hopefully giving something back to those programs as well. And we've done in the UK, the Hill in Oxford, where we started, and then we went on to the NHS Clinical Entrepreneur Programme. We're now on the NHS Innovation Accelerator. And then in the US, we did Mass Challenge, Texas Medical Center Innovation Accelerator, and Ignite as well. So, again, all of those are relationships, and you need things from them and vice versa. And then our collaborators, which Sean was talking about, kind of strategic partnerships. And rather than reinvent the wheel, why don't you team up with someone else who's doing something that complements what you're doing? So yeah, I think for me, I kind of divide it up as our team, clients, accelerators, and collaborators, as to where we've been on our journey with partnerships.
Thank you, Rachel. And that makes me think about Sarah Nelson, in terms of relationships from your point of view. So Rachel mentioned being part of accelerators, being part of networks. Coming from that other way, what you're looking for with regards to you're finding potential partners as well, and how that kind of relation begins.
I think it's really important for us or for either us or those who are looking to partner with us, to know what the skills are of the team that you have at that moment, because it's really important that you identify where perhaps you need help, because that's part of the reason that you're working in a partnership, or where you might need to support your commissioners, or there's lots of different reasons and things that you might need for your team to support this. You need to look at what your opportunities are that fit with your business need at that point. There are lots of accelerators out there, as Rachel has very clearly mentioned, lots of accelerators, and not all of them are right for you at the point you're at the moment. So finding an accelerator that is very strong on evidence generation is very different to finding one that's maybe when you're looking to launch your product first of all. So being aware as to what you actually need. So assessing that good fit as to does it answer the problem you have at that time. And certainly as an innovator, your needs will change probably on a 3-monthly basis, maybe even more. You need to share the same values. Do you care about the same things? Is it important to you? And you do need to like the people that you work with. I think that's really important as well.
Of course. And on that, Sarah Bruce, maybe you could come in, from sort of the background of Silverbuck and those relationships, establishing, maintaining as well.
Yeah, I think I'd echo what Sarah says as well around those kind of shared values, that kind of cultural fit, a kind of openness and trust across partners, and also making sure that a partner will make time for you. I think what we often see with health tech startups, they can sometimes get a bit excited about a partnership, for example, and kind of put all their eggs in one basket, only to realize that that partner has many other partners, and sort of understanding where you fit among kind of maybe a partner ecosystem, for example. And I think in terms of kind of looking for the right partner, from a comms perspective, it's very important to kind of obviously do your background research, not just in terms of the direction of travel for that partner, or what their kind of end goal is, or if they have a healthy balance sheet, for example, but also, what are people talking about? How are people talking about them? What's their kind of perception in the market? Because that might be different from your perception. And then I think, also looking at how you can leverage what they've got. So, whether it's their network, whether they've got you can leverage their kind of brand credibility and that kind of thing, as well as their sort of resource, is also really important when you're looking at who to partner with and how to do it.
Thank you, Sarah. I just want to bring John in from that sort of the investor side, what that feels like as well, the partnership relationship, going on there.
Yeah, no, thank you, Christopher. And sort of, you're probably going to hear a recurring theme, but kind of really focusing on revenue generating your partnerships. And where we've seen that work well, often it's quite a lot larger organizations, but trying to identify what is their biggest challenge. And often it will relate to a current asset they have in the portfolio. Perhaps it's not performing as well as they'd hoped. Perhaps there is significant cost savings to be made in the case of insurers. We kind of find that insurers and providers, public providers, are quite aligned in terms of improving quality, reducing costs. And then industry partners are very aligned in terms of increasing the market sizing and sort of growing their business. So where we've seen it work is where startups often much smaller, trying to contract with a large organization, often they will sort of catch attention, stimulate interest in order to really move a financial partnership forward and kind of have that desire. Often there is a requirement to work with others in the space, because it's quite challenging to sort of offer that end-to-end solution to a large organization. So I kind of really would encourage, and something we've worked on quite a lot, is thinking about kind of subcontracting other startups, other people that can solve that challenge, because they will be very happy to take the phone call for new business that you have generated, and then it's much more likely to be successful and to scale with that larger corporate partner, because you are doing something which is a bit more end to end, rather than sort of leaving it to them to sort out, which you might think, okay, it's one of the largest companies in the world, they can sort anything out. But actually they're often, can be quite far away, from the world of, early stage innovation, companies, single digit million revenue. That often is, really a long way away from, kind of the focuses of, kind of larger corporates. So that kind of, you call it joint venture, call it subcontracting, doesn't really matter in terms of the structure, but I think it's just the willingness of knowing that you as the founder, the startup, you are in the innovation ecosystem, so you are best placed to kind of solve the challenge in a little bit more of an end-to-end way, rather than kind of just being 100% focused on kind of selling your product without thinking, what is the challenge for the corporate partner that I want to grow and deepen and scale the relationship with.
Thank you, John. And that I think leads quite nicely into Sean in terms of a larger organization. Sean, you're senior innovation lead at Chelsea and Westminster. So picking up from what John has said, and those large organizations and that relationship, partnership.
There's two bits to it. Well, there's lots and lots of pieces to it, but just picking up on something and kind of echoing what everybody else has said is, are you ready for a partnership or a relationship? Are you at the point in your journey where you should be coming and having conversations with a bigger organization? Or do you need to go and have a speak and a chat with somebody around one of the many accelerators that might get you a little bit further on in your preparedness? And that takes a little bit of self-reflection. And it's very easy to take an approach of, I'm just going to target somebody really, really big and put all my eggs in one basket, as Sarah said. You've got to remember, and John's touched on this, these big organizations have very busy people in it, and there's lots already strategically happening, and there'll be a roadmap for innovation that we have. So are you ready to commit in that sense? And I think where people sometimes fall down with bigger organizations, they speak to the wrong people, and they may have conversations and have some sort of loose partnership agreement with potentially a clinician or a certain person in an area, and they don't necessarily know the bigger picture of what's happening. So they may not necessarily know the kind of steps that it takes to get something rolled out, from governance, from procurement, etc., etc. They might love the product or the innovation clinically, but there may already be something in place. There may already have been explored. So just make sure you're at a bigger organization that you're speaking to the right people. Because that's all. I have many people come to us as a team, and ultimately it's very hard for us to go back and say, actually, you've just potentially wasted your valuable time for the last however many months because it's been tried and tested, or we have something else, or there's something else in the pipeline. But ultimately, it doesn't fit the strategic direction of the organization. So it's always worth trying to put those pieces of the puzzle, reflect on yourselves as a startup or a company, and say, are you ready to have that? If not, go back and say, how do I get ready?
Okay, thank you, Sean. And Sarah Nelson, I think you wanted to come in.
Just wanted to pick up on something that Sean said, and that's just explaining or putting the point across that partnerships do take time. They take time and they take energy, and so therefore make sure you have that time available to be able to really make the best of it. But also, certainly when you're dealing with the NHS, things do take longer than perhaps they do in industry, and so therefore just being fair to yourself and to others that time is needed.
Important point. Thank you, Sarah. Just to say to my panel as well, any points you want to come in on, just let me know, and I'll certainly bring you in. And to the distinguished guests, your questions are coming in, and I will go through those sort of toward the end of the Q&A part of the session. But do please keep on popping your questions in there for me to put to our panel. So we've spoken about establishing partnerships. So they're established. Some potential challenges. So what are some common challenges in working with partners? And I think this is quite an important topic to speak about candidly as well. So what happens when it maybe doesn't go as well? I wonder, Rachel, if I could start with yourself.
Yeah, I think that's a really good question. I'm trying to just think back to how I kind of categorize it within, teams, clients, accelerators and collaborators. I think from a collaboration and strategic point of view, we're having some really exciting conversations with potential partners that we can both support and complement what each other's doing. But very much to Sean's point of, are you ready for that partnership? We're, as sort of in between startup, scale up, I suppose. I don't know quite where the differentiators lie, but, we are kind of on the cusp of being ready, but aren't quite fully ready yet for a big partnership. So to focus probably more on clients, which is essentially NHS trusts, and I think picking up on Sarah Nelson's point of everything takes a long time in the NHS. So I think that's probably we have great relationships with the hospitals that we work with, but I think part of the probably one of the biggest challenges is the amount of time it takes to get through procurement, the amount of times the goalposts change, and and not just with one single organisation, it's multiple people. Within us, if I think about an NHS trust, you don't sort of have a relationship with the whole trust. It's with individuals that work within the trust. And when they move or they go off on sick leave and you have no warning, or you don't know how long they're going to be off on sick leave and there's no one filling their role, or someone misses a really important meeting that they were representing you at, and stuff then gets delayed and pushed down the road by weeks or months on end. And when you're in a startup kind of bootstrap mode, it is really hard to absorb that as a small business, really difficult to absorb it, because you're relying on these contracts and you're predicting when you'll get income and, all sorts of things. So I think for us, that's one of the biggest challenges, is actually the kind of purchasing process. And the other is from an implementation perspective. We have a phenomenal head of client engagement at Cardmedic who's really experienced and amazing at what she does, really amazing. But she can only do so much. The rest of it has to come from the trust itself. And we have brilliant and passionate clinical champions everywhere we work. But again, they have to navigate within their own organizations. They can't do all of the rollout themselves. They can't do all of the training. They can't gather the metrics themselves to feed into a business case and so on. So they need a team. They need partnerships with people from within their team to work with us. So I think those are some of the biggest challenges are, the procurement side and then the implementation side, because it also takes time to change clinical practice. So, if you're looking at a year is not long enough in a way, you need 3 to 5 years really. But when you're contracting, you're generally starting at a year, sometimes, 2 years, or we do have a 5-year contract, but it's quite unusual. It's generally a year. So you kind of spend most of the time, the first half of the year implementing, and the second half trying to get feedback from people, which is almost impossible in the current clinical, environment. So I think those are some of the challenges that we face with the clients that we work with. So yeah, lots of uptake, but it's just hard to, certain parts of that journey are definitely challenging.
Thank you, Rachel. John, I want to come to you next, actually. So thinking about those, what might be potential challenges in the partnerships, the ways in which you're working?
Yeah, no, absolutely. I mean, what we see most of the time is, often you're getting the partnership done is sort of relatively easy, sort of the easy bit, but it's kind of really being disciplined and pushing on what those commercial terms are. So trying to, lawyers will always say, get the commercial terms agreed before you involve the lawyers. Otherwise, it's super expensive, and everyone's lawyers are going back and forth, and it's not really moving forward because you haven't agreed the commercial terms. So one of the challenges for partnerships, that we see is where the commercial discussion hasn't really been had. It's sort of, we want to work together. There might be an opportunity here and we all benefit, but we're not quite sure when and how much is it worth and when are we going to do it? So what does it look like? So often it looks like, if we talk about sales or distribution partnerships, it's a larger company is saying, we like your new innovative product, we'll help you sell it. But then that partnership or that agreement, there's no minimum payments. There's actually quite little incentive for their sales team, to try and sell something new, which is hard and challenging, and it's kind of unclear how the sales force would be reimbursed, and how many of the sales team are going to be dedicated full time, or how much of their time is going to be devoted to your product. So then it becomes a little bit like a free call, like it's a larger company that's adding to their product suite. If someone says to them, I've been waiting my whole life for this new product, great, they'll kind of make the sale, and something will come to fruition. But in the very likely event that does not happen, people tend not to go around asking for completely new things that they haven't used before. Then actually you have a partnership and there's no growth in it. There's no kind of, there's nobody is growing their business, and so you kind of see it as stalling. So I'd say that's one of the biggest challenges. And what's the solution to that? I think the solution is around having that point of contact, like a lot of people said, but also just being direct and saying, what are your KPIs at the end of this year, at the end of this quarter? And if their KPIs don't relate at all to your partnership, then I think it's a bit of a challenge. You really want to be speaking to the person who is going to, there's going to be loss of blood if they're not supporting this partnership, they're not scaling it. So I think just being direct and asking, what are your KPIs? What's the division's KPIs? How is this going to affect the company if it goes nowhere? And if it doesn't affect the company at all, then it becomes a little bit more like it's kind of nice thing to have, kind of show that I'm doing something, but it's not really going to add revenue to your business. Because I think if you focus on revenue and customers, then a lot of the challenges start to become easier. because then you can start to reinvest in the team. You've got more account managers, etc. You've got higher talent. You've got all these things, which it doesn't make it. It's not going to be a home run, just like that. But at least you have resources to then, to help drive the partnership forward, because it is absolutely going to take, a lot of work, and it might look quite different just because of the nature of what we're all doing. It's all kind of new. It's like new market kind of stuff. So it's it's going to develop and pivot as we kind of move along.
Excellent, thank you, John. And be remiss not to come to Sarah Bruce on this point as well. Your challenges within partnerships, given your background and
Yeah, so I think to echo what John said, it's partly to do with the kind of granularity of the kind of the purpose, the role, the responsibilities of the partners within the partnership, and identifying what it actually means at a more kind of granular level. And I think sometimes what we often find is that when people or organizations, especially startups, partner, it's very exciting for them, but they haven't necessarily considered how they will talk about the partnership, how they will promote the partnership, how they will co-brand the partnership, how they will take it to market effectively. And sometimes they can be on very different pages. For example, one company might not really believe in comms and the value of it, and the other one might spend a fortune on it. And it's about kind of making sure that you're on that same page, and that those are part of some of the early discussions, because you don't want to find that this is a partnership you really want to talk about to the outside world, and actually there are some kind of restrictions, for example, especially if you're a big corporate, that might prevent you doing that. So I think that can be a challenge if you don't address it quite early on. And I also think, in terms of thinking ahead to what hopefully might not ever happen, but what if the relationship does break down? What happens then? Or what if there is some sort of crisis in the partner organization? Again, so if you're partnered with a larger corporate, say it's a software supplier, and something happens to a patient that is using their software, thinking really ahead about what challenges might come up further down the line if you are partnered with another organization that doesn't have the success that you expect to have together. So yeah, they're kind of challenges that kind of tend to be overlooked, because you get caught up in the excitement early on.
Excellent, thank you, Sarah. I'm just going to go to a quick question from the panel, from the audience, and this is from Wesley Fogel, who asks, where do you see areas of unmet need for early stage health tech to enable strong partnerships to being formed? So that early stage unmet need to enable strong partnerships to being formed. And if anyone's got an instant kind of thought about that, then do put your hand up, so I'm not sort of forced to call upon somebody. But yeah, any initial thoughts on that? John? Oh, Sarah.
Sorry, I was just going to say, I think things are changing so often, that both in terms of the amount of products that are coming through and services that are coming through, but also the priorities that are happening within the NHS. And there's some very clear guidelines as to what are becoming priorities, and those do have that. There are definitely products and services out there that support them, but that doesn't mean that they're the only products and services or the best products and services that are available. So I think I'm not seeing anything at this moment personally that I'm just thinking, gosh, that's completely not being sorted. But I think there's a lot of things that we could do better, and that companies could get involved in, that we can improve our pathway management of our patients.
Thank you.
I like the term unmet need, but I think for me that really fits most well in sort of the life sciences sector, where you have kind of you've got high technology risk but lower market risk, because actually you've got patient groups, certain diseases, there is no therapeutics there, there's very long time to diagnosis. So that, for me, that's like a really strong kind of unmet need. When we start getting into the provision of healthcare, I sort of think of it a little bit less like unmet need, because it's not that the market is kind of really there, but there is just nothing to service the market, but there are potential areas of investment and growth. And I think, yeah, the NHS does a good job at signalling some of these areas. For example, addressing health inequalities, the ambition to create, as many virtual beds as we have inpatient beds, the virtual wards. And clearly there will be, it won't just happen. So there will be challenges in scaling and the kind of use case. So, it might start off with, post-operative, it's increasing the time to discharge post-operatively, infusions in the community. So that's an area of need, because you've sort of had big strategic announcement, you've seen investment, you've seen kind of a bit of rollout, but there will always be challenges to scale. So companies that can, increase the number of people going into virtual wards pathways, or can help address health inequalities, I think are areas that are, maybe I don't use the term unmet, but these are kind of growing areas within the healthcare provider space.
Thank you. Sean, did you have a thought on that?
Me too, you read my mind. I think, I was initially probably struggling with the unmet need piece. It might be potentially better as an opportunity. And it's always worth looking at it from different levels. Like there's obviously, as Sarah mentioned, strategic NHS needs and opportunities and priorities. But then there's so from a national level, but then there's regional opportunities and unmet needs, and there's also local ones. So often people will come and tell me about a pitch a product and tell me about it's a £5 billion worldwide issue, etc., but it may not necessarily meet or meet the needs of the local population. So I suppose the answer would be, if you can articulate what you see the opportunity is, or you can get a partner in the organization to articulate their local unmet need or their opportunities, you might get a little bit more traction with that, and that can help you then develop it to potentially regional, to potentially national. So it's always worth looking at it slightly strategically different, and see what the local places have as their priority areas.
Excellent, thank you, Sean. I'm gonna there's a specific one again from Wesley, but it's actually directly to you, Rachel. And it's about the accelerators that you've joined. And Wesley asked, which was the most effective and why? And did you always get what you expected from others as well?
Yes, that's a great question. I think, and again, alludes to what everyone else has been touching on, that and some of the questions actually that are coming up as well around timing of partnerships and things, and again, what those partnerships are bringing to you and vice versa. And I think when I first launched CardMedic, it was during the pandemic, and it was concept to launch in 72 hours. And I'm a clinician. I had no idea about running a business. So I joined The Hill, which was a market access accelerator run by Oxford University Hospitals and Oxford University. And it was a combination of, it's for early stage companies, and a combination, there were a couple of clinicians on there, but everyone else was generally non-clinical. And for me, that was the perfect accelerator for that moment in time, because it took me from being a clinician with absolutely no knowledge at all, and kind of gave me the basics of business plan, financial model, pitching to investors, pitch deck, value proposition, health economics, etc., and had fantastic mentoring. And it was a relatively intensive 3-month program, but I could put in the time at that point because I was actually on maternity leave and stranded in the US. So I had not much else to do. So from that point, that was the right accelerator at that time. And then the clinical entrepreneur program, again, just took me to the next stage, because it suddenly put me into a group of being, one of only 2 clinicians on an accelerator to one of over 700 clinicians who are at that point primarily clinicians. Now that the entrepreneur program opens it up to non-clinicians, but anyone who works in the NHS, which is fantastic because it just broadens the network and the scope. And again, that was building on the kind of foundational knowledge that I'd learned from The Hill. So it's always helpful and relevant to learn about these things, but there were a few things I thought, okay, well, I've covered that, but I would like to focus on these other areas. But a huge thing that came out of that was the network. And then now the NHS Innovation Accelerator has been absolutely fantastic for the stage we're at now, because we're working with 26 different trusts and so on. And so and that really does not include how to write a business plan and how to do a financial model. That is really focused on really practical ways to scale and developing networks and partnerships that are really valuable to you at your stage of the business. And it's a much smaller cohort. So I think there aren't any that they've all added huge value. In the US, the Mass Challenge early stage accelerator was great to be on, but it wasn't focused. So if anything, you know, that we actually won $50,000, so that was a fantastic program to be on, but probably less relevant. But the health tech one, the for Mass Challenge, was really useful, and of course TMC, Texas Medical Center, because it's really helping us hone our go-to-market proposition and for the US, which is, you know, a value proposition. So I think all of them have brought their own unique, really helpful things to them. But as with all of these things, the more you get out, the more you put in, the more you'll get out. So if you just don't really bother showing up to the webinars and you don't really engage with the opportunities to speak or to network and meet people, or to put out your network to introduce, you know, to make connections for other people, then you're not going to get much out of it. So there's certainly none that I've thought, oh, I wish I hadn't wasted my time doing that. They've all brought something to the table. Having said that, apart from there's one accelerator in the US, which is Cedars-Sinai, that I've got my eye on, I'm not applying for any more because they are time consuming. So I think they have a certain life cycle to them for where you're in your stage of business.
Thank you.
Okay.
So there are some questions in the screen that I've got here. Some of them are quite filled out. So if my eyes are wandering and looking, I'm reading through those. I'm trying to paraphrase. So bear with me a moment. But John, did you come off mute? Did you want to? That'll give me time to actually go through some of these.
I mean, just a very small point about accelerators, but you know, obviously Rachel's covered it very well. But you know, from an investor standpoint, obviously, you know, we like the local accelerators. You know, it allows you to kind of go deep and, you know, solve challenges. You know, for example, if, you know, NHS providers a challenge, you know, obviously Sarah's on the call, you know, Digital Health London, so very good at that. But the overseas accelerators, you know, certainly attractive, you know, from an investment standpoint. So, you know, we've had several founders now, you know, been accepted onto Y Combinator. It's a very famous accelerator, you know, Silicon Valley, Airbnb, Stripe, you know, it's tech, kind of based on Paul Graham. Some great advice there on building technology companies, you know, resources there if your people are not already aware. But you know, really, yeah, that is kind of the type of accelerator that kind of moves the needle from an investor standpoint, because it's just a huge amount of visibility. You're also moving into a very large market. You know, there's a lot of, you know, angel investors, but obviously US angel investors kind of means a different thing. They can be pretty large. You know, it's yeah, it could be as large as some kind of European VC firms in some cases. And so, yeah, that type of, you know, overseas accelerators, I think, you know, is something that we find quite attractive. You know, Rachel's already mentioned Mass Challenge, the ones in Switzerland, but it's sort of exploring other markets can help to, you know, diversify and, you know, work out where's the product going to reach product market fit.
Thank you, John. At that point as well about, you know, outwardly looking also. There's a really good question here, which I wanted to actually pose myself. So I'm glad that Tom King has put it in here. So Tom is from a startup in their absolute infancy, in his words. And what are your thoughts, panel, on reaching out to a potential competitor to explore as a partnership? So their view is that, you know, we should seek to collaborate with others who are compelled to reduce health inequalities through educational tools. Why wouldn't we? So a partner, a competitor as a partner. Sarah Nelson, if I start with you on that.
I think that there are definitely companies out there who are interested in working together, definitely. There are also companies who would rather not. So I would say use some of your networks or come to environments potentially like ours. We have opportunities where we could speak about things, and we've got that insight where we know where maybe people might be interested or happy to have a conversation. But just be aware of what your offering is. Think about it's personality driven, and it's what is involved in the actual product that you're talking about. But certainly there are opportunities out there for people, but it has to be handled carefully, both for your sake and for your competitors' sake.
Thank you. Sarah Bruce.
Yeah, I think it's a really interesting question, and we've had, you know, lots of clients that partner with each other where they originally seem competitive, and you know, including myself, I've met competitors this week actually, and I went into those meetings thinking, not looking forward to this. There's not going to be a relationship here, and I've come out with a completely different perspective on things. And I think, you know, it's about personalities, it's about openness, and I think that cultural fit from the start. If you meet with someone and they kind of shut down and don't want to share their challenges and their opportunities with you, you know it's not the right fit. But it doesn't mean everyone's going to be like that, and you should keep potentially exploring partnerships. And I think, you know, partnerships can obviously with competitors can, you know, do many different things. It can, if you're looking for M&A, for example, if you're looking to sell, it can add value in that sense. Obviously kind of adding value in terms of different, you know, additional functionality or whatever it might be, even if there, you know, is likely to be some overlap. So, you know, I think my advice is put the feelers out. Don't be scared if you've been sort of rejected once, and keep going with it. But, you know, in some ways, hold your cards fairly close to your chest in those initial meetings until you really get to know the organisation and what they're all about.
Thank you. Rachel, please.
Yeah, just wanted to sort of chime in on that, and thank you, Tom, for your message. You know, my feeling is always sort of safety in numbers and work together, and you know, I'm really pro collaboration, and I think, like you said, health inequalities is like boiling the ocean trying to solve health inequalities, and there are many different angles to come at it from. That's obviously, you know, without getting too nitty-gritty, but that's just health inequalities. They'll be the same across all sorts of different industries or areas of focus. So, you know, and a big part of reducing health inequalities is improving health literacy and patient education and engagement. And yeah, that's, you know, we're definitely working in the same space, but that's not to say we're competing. So, you know, my feeling is always being really open to those sorts of discussions. And even if it's like, this will be amazing, let's do it, but it's just not the right time because it's going to take a certain amount of money to do the development work, to do an integration or whatever that might be. So we'll park it. Or actually, do you know what? You know, again, we're not competing, but doesn't feel like quite the right fit. That's okay as well. The kinds of ones that I've thought, I'm not quite sure about this, are where, you know, I've had someone that was like, within the first 9 months of doing Card Medic or something, someone contacted me allegedly from Silicon Valley with this great clever AI tool, and, you know, wanted to know everything about what we were doing and wanted a meeting and a product demo and wanted to collaborate, and it just didn't feel right. And, you know, I think they said something about signing an NDA, but either which way, we just thought, it's just, this doesn't feel right. B, what they're doing doesn't really complement what we're doing and make sense. And C, you just kind of get spidey sense where you think, I don't know what you're up to, but I don't think I'm going to work well with you or like you very much. So I think there's that angle too, that, you know, even if it is a good fit, personalities might not work. But yeah, my take is definitely, I'm always up for those kind of conversations.
Excellent. Thank you, Rachel. And I just wanted, from Sean's point of view, actually, you know, is what you see as collaboration and how that comes into your world, and that collaboration has been sort of sorted out before it gets to you, perhaps, you know.
It usually is, but there's lots of companies who work on partnership models, and you can, I suppose, you can nearly piggyback, for choice of better words, on their integrations of their technologies, to try and make that whole process a lot easier. So look to who's already in situ. Is there an obvious complement that you can bring to them? But, and this, I suppose, echoes Rachel's point as well, is make sure you're culturally the same fit. That's huge, because ultimately, if that external partnership, external to us, falls down, and there's something in place, it's very difficult to unpick and get right if you're not on this culturally the same fit. So yeah, don't take every opportunity, trust your gut, but definitely look to who's already in place. There's some big kind of providers out there who actually look to collaborate and want to build that sort of partnership type approach. So yeah, definitely explore those avenues.
Thank you. And it's really good to get that overview from from yourself, Sean. So I appreciate that. I'm sure the panel will as well. We're coming up to what time are we now? So 22 minutes past. So still a few more minutes to go. There is a question on evaluating potential partnerships, actually, where the focus is in terms of short-term needs versus the long-term needs of the company and product. So do you focus on partnerships that will benefit the current stage, or do you think beyond that? So are you thinking strategically about your partnerships and at what level? I wonder, John, if you've got a thought on that.
Yeah, I mean, so I think there has to be a short-term benefit. Yeah, otherwise the partnership's not going to grow, the relationship's not going to develop. There's not going to be any kind of transaction which kind of moves things forward. But I think it's a balance. Yeah, right. I think we see a lot of companies that have what seem like really attractive, but the kind of very long term, if this, if that, then this, and so and it's like we kind of we want to get excited, but really if the company is not kind of significantly revenue generating, then you're kind of on like a 12-18 month timeline, right? You're kind of on a runway. So this is like an R&D, it's like a commercial R&D project, and you got to hit something, value inflection point, a milestone. You got 12 months to do it. If you don't, we'll find something else to do. So I think having been really disciplined on what the short term, what is coming out of the short term is probably kind of where I would gear things. Because I think naturally, we find it easy to get excited about, oh, this could be huge if my partner moves into this space and shores up the supply chain, and then my product will become really relevant and we'll access this huge market. I think we kind of naturally dream, but the discipline is, okay, what's happening in the next 6 to 9 months? Is it going to close this before the end of the year? Otherwise, we're not going to have 6 months left in which to fundraise, if that is the strategy for the company. You kind of don't want to be closing on, let's say you've got 18 months runway. You don't want to be closing on month 16 and then trying to raise money. It's disaster. But we kind of see it quite a lot. You want to be raising money when you kind of don't really need to raise money, but certainly 6 months before the end. Otherwise, it just becomes like almost impossible to do it because of the dynamic, because investors are partners as well, and there's kind of a relationship that it needs security. People need to be secure and kind of not too desperate in order to do business with each other. And the same with larger organizations. They need to be fairly sure that you're going to be around, because they're concerned about the reputational risk of working with you and then you not being around and what happens to the project and all that kind of stuff. So I'd focus more on the short term, because we kind of naturally are all dreamers, because we're in the innovation and entrepreneurship space.
Thank you, John. I wonder, Sarah Nelson, if you have a view on that one.
If I'm thinking about how we evaluate companies, it's really important for us 3 major things that we look at. We look at business credibility, and certainly for the length of our program, our main accelerator program is a year. So we need to make sure that that company will still be there in a year to be able to make use of the introductions that they've had. We look at an NHS need. So does it actually support an NHS need? Is it a need that's a priority at the moment? And therefore, what are the likelihood of chances of partnerships working? And then we look at whether or not they're a fit for our accelerator. Are they at the right space and the right time? So they're the 3 things we look at when it comes to evaluating our company partnerships. So that works for us.
Thank you. How are we doing for time? Oh, 27, that jumps up really quickly. So I think thank you is the next sort of thing to come from my mouth, actually. But I do want to ask each of you, actually, just very quickly and briefly, in the interest of time, just tell us what your next partnership is, whether it be short, medium, or long term, whether that be professional or personal, actually, just in the spirit of talking about partnerships. So just to sort of put a spotlight on and pick immediately, I'm going to go with Sean. What's your next partnership?
I knew I was waiting for this. Well, give a real world example where I'm looking at building a new remote monitoring pathway for a very specific cohort of patients. And we've really taken a step back. There's lots out there in remote monitoring, we know that. But we really spent a lot of time really defining the problem and having real, and it goes back to my opening point around clarity. So we've real clarity of what that problem is, who are the patients within that cohort that this pathway is going to serve, the volume and sense. So is it actually viable, or is it necessary? Is it a big enough problem that needs to be addressed? So we've really got real good clarity, and I've worked really hard with the service clinical leads and their management in getting that. The point and the partnership piece where we've fit in, so that's one of my internal partners. The external partner piece is we're looking to the market now for who is that best of breed strategic partner for that, who can deliver currently part of it, but there's other parts, and ultimately this pathway will grow, and can they service the future? And we have clarity on what that looks like. Excellent. And we're now in those conversations about making sure that they can get what they want out of it. Can they service it? So yeah, it goes back to that clarity piece. We're on the same, and it'll be a successful, happy partnership.
Thank you very much, Sean. Sarah, Bruce.
Yeah, I think our next, and it's an existing partnership, but one that we're extending, I suppose, is our advisory board. So we have an advisory board, and we have a really strong partnership with those individuals. It's not commercial in any way. It is a really just strong relationship, and we can leverage the advisory board's network, and they can leverage ours, and they bring a huge amount of kind of knowledge and expertise to Silverbuck, and we can help them in different ways too. So we're looking at extending that further and bringing more to our advisory board in by-way partnership.
Thank you very much. John.
No, thank you. I mean, so first of all, I mean, Rise is a partnership. So yeah, we have partnerships between ourselves. Obviously, our investors in the fund, limited partners. These are partners. Any company that we work with, I mean, it's also a partnership, but probably most relevant is an investor partnership. So large US hospital group. We're committed to making investment together. Why would we do that? Because we're both in different regions. We add different things. We do quite a lot of early stage, but also support late stage companies, sort of pre-IPO type financing. They're in a different region. It's validation, it's co-development, but it's also seed capital as well, and beyond in another market. So I think the partnerships are where there's enough overlap so that people understand each other, but then there is also significant other strengths that sort of come together. So yeah, that's us.
Thank you, John. Sarah Nelson.
There's two very quick partnerships. One is we are looking at extending our partnerships within our diverse founders, so supporting minority ethnic women founders and also those with physical or mental disability. And then the other part, obviously, as we're on this particular webcast, is with Pitchfest and supporting Pitchfest at the companies that want to come through to be able to show and get their partnerships by coming to Pitchfest and really explaining to us some of the great things that they're doing out there.
Perfect, very important. And finally, Rachel.
So I think in the UK, we're in the final stages of procurement with a few hospitals, so that will be really exciting when that all comes through. And in the US, we are just launching with the Federally Qualified Health Centre in Houston at the moment. So that's a new partnership, and it's a different way of working, definitely. So the implementation will be, will be a key part of that, making that successful. And we're also in the US in the kind of final stages of launching a really exciting partnership with a huge accountancy firm, which works with a lot of healthcare providers in the US with a focus on revenue cycle management. So thinking about how we can work in that space. And we've been speaking to them for quite a long time now. We met them on Mass Challenge, and we are, have had some really exciting discussions. So for us, that could be an amazing strategic partner in terms of, channel partner and route scaling in the US. So yeah, that's a sort of UK-US updates.
Fantastic, congratulations.
Thank you.
Panel, thank you all so much. I've really enjoyed getting to know you more and having the conversation we've had today. And thank you all for joining us. Just to let you know quickly that applications close on the 1st of December for Rewired Pitchfest. So please do apply, with virtual heats taking place the week of the 15th of January, from which 4 finalists will be, from each category, will go to pitch live at Rewired in March next year. So thank you all so much. Enjoy the rest of your days and happy partnership building.
Thank you for having us.